ladies and gentlemen, let me start by apologizing. I am very sorry about the fact that we are starting late. I honestly believe we'll be able to start at 4 p.m. But
the discussions have been intense and have consequences, and therefore it was necessary to go through them with clarity. Fellow Kenyans, the coronavirus disease has continued to affect the world in an unprecedented way. Global statistics today indicate that there were 266,073 confirmed cases and 11,000 deaths. The epicenter of the virus has shifted from China to Europe. In Africa, confirmed cases as of March the 21st were 572, with 12 reported deaths. On Friday, we announced that there were no new coronavirus cases and that the 7 patients who were tested positive for the virus were undergoing treatment and were stable. We continue to monitor their progress as well as the individuals who have come in contact with them. And I may add here that they continue to be stable. In the last 72 hours, however, we have received confirmation of an additional 8 cases who have tested positive for coronavirus. This now brings the total number of those who have tested positive to 15. Out of the latest 8 cases, 5 are Kenyans and 3 are foreign nationals. The foreign nationals are 2 French people and 1 Mexican. All the 8 are imported cases from Europe and America. The ages are between the age of 20 for the youngest and 57 years for the oldest. All the 8 came through the Jomo Kenyatta International Airport between the 4th of March and the 17th of March. And they all have been isolated at various facilities and are being monitored by our teams. We are tracing 363 persons who had come into contact with these patients. So far, we have also an additional 3 people waiting processing at Bagathi Hospital. The rest have been processed and discharged. All the patients, except the one who is at the coast, at Msambweni, are all in stable condition. The government is organizing to having the patient in Msambweni airlifted to Nairobi for further treatment. As I mentioned on Friday last week, our actions continue to be guided by the trends that we have observed in other countries. Evidence from other countries indicates that the number of infected persons increases dramatically in the second week following confirmation of the first case. I did further indicate that these coming 2 weeks are extremely critical for this country as we seek to contain the outbreak. We remain focused on emphasizing high levels of hygiene and the maintaining of social distance as the most effective containment measures. This morning, when we were launching the CT scan center in Jomo Kenyatta Hospital, you will recall, those of you who attended the conference center, the press conference, that throughout the discussions with doctors from many centers in China, the French doctors as well, the emphasis was on exactly the same thing: the levels of hygiene and social distancing as an effective measure. Fellow Kenyans, the government has in the past few weeks announced various measures that are aimed at containing this virus. However, much to our disappointment, we have noticed that majority of our people have continued to ignore these measures and are behaving as if it is business as usual. As I cautioned last week, this disease is not a joke. Kenyans must treat this matter with the seriousness it deserves by adjusting and changing their lifestyles. If we continue to behave normally, this disease will treat us abnormally. Behaving normal under these circumstances is akin to having a death wish. Therefore, in addition to the measures that we have already announced, the government has today resolved as follows. Number one, all international flights are suspended effective Wednesday, the 25th at midnight. The only exception to this rule are cargo flights whose crew must observe strict guidelines. Those coming into the country between now and Wednesday, may they be Kenyans or foreigners, will undergo mandatory quarantine at a government-designated facility at their own expense. Countries wishing to evacuate their nationals must make their arrangements to do so within this period. Kenyans who are currently in foreign countries and will not have come back within the said period are advised to observe the guidelines issued in the respective countries wherever they are. Number two, whereas we had allowed Kenyans and foreigners with valid residence permits to come into the country, we have observed that there are those who are not observing self-quarantine protocol. Consequently, NAC has decided that all persons who violate the self-quarantine requirement will be forcibly quarantined for a full 14 days at their cost, and thereafter arrested and charged in accordance with the Public Health Act. And I would like to add here that this will apply to a senior government official in Kilifi who defied and refused to self-quarantine, who is now being forcibly quarantined in a facility and upon the completion of the period given by our health authorities, the person, the official, will be charged in a court of law. And this will be followed by each and every person who violate this. I would like to urge, particularly those students traveling from the UK, traveling from the US and other countries, to observe this rule very strictly. And it will be enforced. And further, I would like to appeal to the younger people who are coming not to be close whatsoever to the older persons, because as has been shown by statistical evidence elsewhere, as soon as the young people come into close proximity with older people, the older people begin to die. So even as we talk about quarantining and we talk about distancing, it is important for people to remain alive to the fact that the older people are a lot more vulnerable. 3, effective midnight tonight, all bars will remain closed until further notice. Restaurants are to remain open, but only for purposes of facilitating takeaway services. This is meant to secure the social distance requirement, noting that the increased risk of transmission that those facilities can cause. Further, in order to give effect to the social distance requirement in public transport sector, all public service vehicles must adhere to the directive issued on Friday, March the 20th, failure to which the respective SACCO licenses will be revoked. The Inspector General of Police, who is present with us here today, has been directed to enforce this directive. Lastly, having noted the non-compliance of individuals, may they be in religious organizations, may they be in other social gatherings, as issued on the 20th of March, the NAC has directed the suspension of all church, mosques, funerals, and other social gatherings, and funerals are restricted to immediate family members only. Members of the Fourth Estate, you will remember that the experience of Italy started exactly the way we are behaving, where we have told people not to go into gathering, but some of them have decided, because of tithe and because of contributions in a church or because of contributions in other gatherings, that they must continue to do so. We all know what is happening in Italy today. Yesterday, 789 people lost their lives in 24 hours. There is nothing that we have done that is not going to give us exactly the same experience if we exhibit exactly the same behavior. It would be responsible of this government to allow this sort of behavior to continue, knowing very well what consequences they are. When you go into this kind of social gatherings, it is almost like committing suicide in the long run, in the medium term. And the social media today is abuzz with individuals who are nauseated by the behavior that Kenyans are exhibiting, even as we know the circumstances that are ahead of us. Once again, we are aware that these measures may be inconvenient, but I assure you that they are necessary to meet the objective of keeping Kenyans safe. Long after coronavirus has been secured, we will still have weddings, we will still have churches, we will still have mosques. But what is the point of continuing with these institutions as if nothing is happening and cut your gathering post-coronavirus by half? What is the logic? What is it that I do not understand when we tell Kenyans this is not a joke? So in the coming week, you will be observing enforcement measures that the government will have to take to make sure that what we are saying is correct. Even gatherings within the streets that are unnecessary should not be held. Stay at home. Stay at home. If you are not doing anything in the town, if you are not doing anything in the shopping center, if you are not doing anything in the dukas and kiosks, if you are not doing anything in the market, we should only be opened along guidelines that the security operators are going to observe. Go home. Stay at home. People are getting sick because they came in touch with somebody else. The people we are talking about, the 8 people we are talking about, some of them are tourists. They have been to the pubs, they have been to the hotels, they have come in touch with some of us, and you don't know, as you speak next to your colleague, you don't know who is sick. And therefore we are saying this is not business as usual, and we will ensure that it will not be. I would like to ask the PS, Karanja Kibisho, to also say 1 or 2 things before also I ask the IG to speak to some of the points that we have raised.